So any question about the ovulation induction? When we do the ovulation induction, not always, it should not be randomly. It should be done improperly. And sometimes need ovulation induction, as sometimes in case of PCO and other ovarian function impairment, there is an ovulation, so we need ovulation. So for ovulation, the process is called, if you stimulate the ovary to produce Graafian follicle and to release ovum, this is called ovulation. So if you want to do by outside the human body, we should we should trigger the ovary. So there is some drugs for this. What are the drugs? That is clomiphene citrate, the clomiphene citrate, then letrozole, then gonadotropic hormone like FSH, LH, HCG. This stimulate the ovary and release the ovum. So there is some mechanism for this, and there is rules about this. And another is what you do if there is oligospermia and asthenospermia and then azoospermia, then we should do accordingly. Suppose azoospermia, we need to ideally we refer to the urologist, and they assess thoroughly and they evaluate the patient. There is basovagogram, where is procedure. They see where there is obstruction, and testicular biopsy where there is spermatozoa formed or not, and so many way they are evaluate the patient. Okay. Now, so patient should be explain everything, counseling, and should be patient for the time and conception, and they need proper time to stay for sexual relationship. And if one husband away abroad and no relationship, it's not possible. So you should explain everything. Then what are the other management? So some drug management, some surgical management. The endometriosis is so notorious. And endometriosis destroys the all reproductive function by causing pelvic adhesion, tubal block, and so and so. So there is a term pelvic endometriosis, laparoscopic surgery, adhesiolysis and coagulation, destruction of the endometriotic tissue like this. So there is laparoscopic evaluation, laparoscopic surgery, better always. And if there is cyst, we should do laparoscopically. And there is a dye test by the laparoscopy. Actually, I need to finish in one lecture, so I am focusing my main things. Okay, so dye test, there is you use methylene blue dye, so the uterine cavity passes like DNC. The instrument like DNC, we pass the dye through the uterine cavity, and we observe laparoscopically dye passes through the uterine cavity and then fallopian tube, present or not. So this is dye test. And there is a question of ovarian drilling. We, the polycystic ovary become large, thick wall, so needs puncture. That is called ovarian drilling. Sometimes we do the ovarian drilling in case of PCO, polycystic ovarian syndrome. And surgery mainly this management. And others are there is artificial reproductive technique. This, you heard the name. IVF, IUI, like this, ICSI, these are the artificial reproductive technique. I want to show something from this. Right. This is for the post-graduation actually. Sometimes, during ovulation induction, there is ovarian hyperstimulation syndrome. So when we do ovarian induction, we should be very careful using these drugs. Clomiphene citrate and gonadotropin. If we use this regimen, then day 2, 3, 4, clomiphene citrate 50 mg, and day 5 and 6 like this, and day 7 and 8 gonadotropin, 9 and onwards ultrasonography and dose adjustment. So, intrauterine insemination, you may ask some question about the intrauterine insemination. I will show this. That is in case of oligospermia and some problem in the infertility unexplained, then we do the intrauterine insemination. We concentrate the semen and we put in the uterine cavity at the time of ovulation. The preparation of the semen is important. We take the semen here, okay, by some centrifuging machine. We concentrate the semen. After concentration and some reagent mixed with the semen. This is the semen, concentrated semen, and mixed with the reagent, some reagent that is enriched with some tonics for the spermatozoa. Then you know those are more mobile, good spermatozoa, they will stay up. So from as less as possible, more good quality semen mixing with their special reagent, we pass through this intrauterine tube. This is cannula, one type of cannula. Through the uterine cavity, it is implanted in the endometrial cavity. Through the syringe and through this cannula, we keep the prepared semen into the uterine cavity during the time of ovulation. Okay. I think today I have no time. So, assisted reproductive technique, you should know intrauterine insemination and in vitro fertilization. And in short, this is overall assessment of the infertility. You should go through the books and you should see the picture and the main points, and you should prepare for the exam. Okay? Thank you.